The month of February is all about the heart as we honor Heart Health Month and also celebrate Valentine's Day.
Fox 59's Anna Darling shares a special story that highlights the intersection of both. Anna.
Hey, good morning. Annette and Kenneth Holloway. They've been married for about 20 years now, and when they took their vows, saying in sickness and in health, they had no idea how their journey together would really embody that. And it all started with Annette's heart.
Annette and Kenneth Holloway's marriage has been a journey.
I believe the Lord had brought her into my life, teaching me how to love.
You could call them pioneers, connecting online back in 2003 thanks to a mutual friend.
We always talk in the chat, and so
constantly.
And so then he decided to come and visit me, and then he proposed.
Soon after getting married in 2005, their two children came not long after, and they went about their lives. Annette worked at IU Health Methodist as a nurse.
I work straight night shift, 12 hours. So I miss my work, I miss my job.
That's because in 2019, she was diagnosed with heart failure. She kept working and living on as normal until she couldn't anymore.
I noticed that my heart is jumping, and I feel that my legs muscles is becoming weak.
Annette and her doctors decided it was time for her to use an LVAD heart pump.
LVAD is a left ventricular assist device. It helps move blood from the heart that is weakened over time, and it helps move that blood to kind of the rest of the body.
A surgeon implants the pump on the heart. It then connects outside the body to a controller and battery pack that has to be worn and charged at all times. If the batteries die, the person could die.
You have to carry with you your batteries and extra batteries, and then have to make sure that you know what to do when times like that happens.
So when the Holloways decided they wanted to renew their vows in Annette's home country of the Philippines, there was a lot of work that had to be done.
I had people from TSA to come down, where they was given all the instructions on when you travel.
If we're traveling, we have to make sure that we have enough batteries that to carry to be safe, and then make sure that that's charged really good.
Adam says they encourage their LVAD patients to travel as long as they find healthcare centers they can go to in their destination. The IU Health team found one in the Philippines for the Holloways.
It's amazing to see our patients travel or be able to experience seeing new family members or seeing family members they haven't seen for a long time.
The Holloways say their vow renewal in December was a magical day, even down to Annette's dress, which had to be modified to hold her LVAD device.
The experience, what we went through to get there, a lot of people look at that video, but if you knew what we went through just to get there.
They know the true meaning of vowing in sickness and in health.
So in sickness and in health, that's always been the best moment of my life.
Good times and bad times. So we got a chance to show our children that. So that was I think that was one of the greatest things,
Now, the Holloways, they have a beautiful story, but an important takeaway is to know the symptoms of heart failure. Those include persistent shortness of breath, especially when lying down or active, weakness or swelling in the legs, and fast or irregular heartbeats. You should consult your doctor immediately if you have any of these symptoms.